If you are taking amlodipine, losartan, or lisinopril for your blood pressure, and millions of Americans over 60 are, I need you to watch this entire video. Not because these medications are dangerous, not because you should stop taking them. They are prescribed for very real and very important reasons, and I am not here to frighten you away from your doctor's recommendations. I am here because there are specific things happening in your body on these medications, right now, that your doctor may not have had time to explain. Side effects that are being dismissed as aging, nutrient changes happening silently inside your cells, and interactions between these drugs and everyday choices, food, supplements, other medications that can either make your treatment more effective or quietly work against it. What you do not know about your blood pressure medication may be affecting your quality of life every single day. I have been in clinical practice for over 10 years working with older adults. Blood pressure medications come up in almost every single visit, and the same gaps in understanding come up every time. Today, I am filling those gaps, one drug at a time. Every fact in this video comes from published research. If you have not subscribed yet, please do that right now. 2 seconds. Thank you. Now, let us start with amlodipine. Amlodipine, what nobody tells you about that ankle swelling. Amlodipine is a calcium channel blocker, one of the most prescribed medications in America. It works by relaxing blood vessel walls to lower pressure. But here is what most patients are never told. That same relaxation increases hydrostatic pressure inside small capillaries in the lower legs. Fluid leaks into surrounding tissue. The result is ankle and leg swelling that is worse by evening and better after lying flat. A 2025 multi-center retrospective cohort study published in PubMed, PMID 41855214, followed 292 hypertensive patients on calcium channel blockers, 94.8% of whom were taking amlodipine. Peripheral edema developed in 38.7% of patients, with a mean onset time of 8.3 weeks. Patients taking the 10 mg dose had a 42.5% edema rate versus 33% at the 5 mg dose. The swelling was significantly more likely in those who stood for long periods daily. Critically, this swelling is not caused by fluid retention. It is capillary leakage. It does not respond to diuretics. Yet a study published in the American Journal of Medicine found that patients on calcium channel blockers are up to 60% more likely to be prescribed loop diuretics such as furosemide to manage this edema, adding a second drug with its own risks to treat a side effect of the first. One more overlooked side effect: gum overgrowth, gingival hyperplasia. A PMC case series documented amlodipine-induced gingival enlargement at the standard 5 mg dose in adults aged 50 to 65. The gums swell, bleed, and can begin covering the teeth, painlessly, which is why patients miss it. It partially or fully reverses when the medication is changed. What to discuss with your doctor. If you have ankle swelling on amlodipine, do not assume it is heart failure or kidney disease before ruling out the medication. Ask your doctor specifically whether the swelling could be amlodipine related and whether dose adjustment or switching to an ACE inhibitor or ARB might be an option for your situation. Elevating your legs for 30 minutes twice a day reduces the swelling mechanically. And if you notice your gums have changed, bleeding more, looking puffier, feeling different, mention amlodipine to your dentist by name. Lisinopril, the cough that is not a cold, and the risk that is serious. Lisinopril is an ACE inhibitor with genuine protective effects on the kidneys and heart, a first choice for patients with diabetes or heart failure. But it prevents the breakdown of a substance called bradykinin. When bradykinin accumulates in the airways, it irritates cough receptors, producing a dry, persistent, tickling cough that does not respond to cough syrup, does not produce mucus, and does not go away on its own. A randomized controlled trial published in PubMed, PMID 10344043, measured cough incidence directly, 60% in the lisinopril group versus 15.6% in patients switched to telmisartan and 9.7% in the placebo group. That is a dramatic difference. And a cross-sectional epidemiologic study published in Science Direct found a 19% prevalence of cough in ACE inhibitor users versus 9% in the control group, with an odds ratio of 2.3. Being over 65 and being female both independently increase the risk. The more serious risk is angioedema, sudden, severe swelling of the lips, tongue, or throat that can obstruct the airway. It is rare, but a medical emergency when it occurs. ACE inhibitors account for up to 30% of all ER angioedema cases in the US. Black patients face a 3 to 5 times higher risk due to differences in bradykinin metabolism, a fact most patients taking lisinopril have never been told. What to discuss with your doctor. If you have a persistent dry cough and you are on lisinopril, that cough is almost certainly the medication. Do not spend months treating it as allergies or a sinus issue. Ask your doctor about switching to an ARB such as Losartan or Valsartan, which provides similar blood pressure and kidney protection without the bradykinin accumulation that drives the cough. And if you ever experience sudden swelling of your lips, tongue, or throat, go to the emergency room immediately. Do not wait. Losartan, the electrolyte drain most patients never monitor. Losartan is an ARB. It works at a different point in the same hormonal pathway as lisinopril. Because it does not raise bradykinin, it rarely causes cough, which is why it is often prescribed when lisinopril is not tolerated. What most patients on Losartan are never told. Losartan increases urinary excretion of sodium, magnesium, calcium, potassium, and phosphate, documented in the NCBI Stat Pearls monograph on Losartan. In a healthy adult with a varied diet, this is manageable. In an older adult on a diuretic, or with poor appetite or restricted diet, this electrolyte drain produces symptoms that look like completely unrelated problems. Magnesium depletion from Losartan is particularly significant for seniors. Magnesium is required for over 300 enzymatic reactions in the body: muscle function, nerve signaling, blood sugar regulation, and sleep quality. Low magnesium produces symptoms including muscle cramps, fatigue, poor sleep, heart palpitations, and constipation. These are symptoms that many older adults attribute to aging. They may actually be Losartan-driven magnesium loss. A Society of Hospital Medicine case report documented a patient who presented with a syncopal episode and critical electrolyte abnormalities: potassium 2.5, magnesium 1.4, calcium 6.3, after starting Losartan 25 milligrams as his only medication. Everything fully resolved once Losartan was stopped and electrolytes replaced. There is also an important interaction most patients are never warned about. Taking Losartan with NSAIDs, ibuprofen, naproxen, even aspirin in some cases, can significantly reduce the blood pressure lowering effect of Losartan and increase the risk of acute kidney injury, particularly in older adults with any pre-existing kidney changes. The NCBI Stat Pearls document on Losartan specifically flags this interaction as requiring periodic monitoring of renal function. What to discuss with your doctor. Ask your doctor whether your basic metabolic panel, the routine blood test that measures electrolytes, kidney function, and glucose, is being checked regularly while you are on Losartan. It should be done at least once a year, and more frequently if you are also on a diuretic. If you are experiencing muscle cramps, fatigue, poor sleep, or heart palpitations on Losartan, ask specifically about your magnesium level. It is not always included in standard panels and may need to be requested separately. And if you regularly take ibuprofen or naproxen for pain, tell your prescribing doctor. This combination needs to be evaluated. What all three of these medications have in common, and what to do about it. Amlodipine, Lisinopril, and Losartan are effective medications that have helped millions reduce cardiovascular risk. But each interacts with your body in ways that go well beyond lowering a number on a cuff. All three need consistent monitoring: basic metabolic panels, kidney function, electrolytes, and home blood pressure readings. White coat hypertension in a doctor office can drive unnecessary dose increases. An Omron home monitor at Walmart, Costco, or CVS gives your doctor a far more accurate picture than a single office reading. Food interactions matter too. Grapefruit and grapefruit juice inhibit the enzyme that metabolizes amlodipine, raising blood levels and the side effect profile. If you eat grapefruit and take amlodipine, your effective dose may be higher than intended. On Losartan, high-potassium foods, bananas, avocados, potatoes, spinach, should be eaten consistently rather than in sudden large amounts, as the drug already alters potassium handling. The conversation to have at your next appointment. I want to close with Walter, 71, a retired electrician from Indianapolis, Indiana, on amlodipine 10 milligrams and lisinopril for 4 years. A dry cough he had treated with cough drops for 2 years. Swollen ankles every evening. His doctor had added furosemide 6 months earlier to manage the swelling. His magnesium had never been checked. We went through all of it. The cough was lisinopril. We switched to Losartan and it was gone in 3 weeks. The ankle swelling was amlodipine capillary leakage. We dropped the dose to 5 milligrams, added leg elevation, swelling reduced within a month, furosemide tapered off. Magnesium came back at 1.6, below normal. We supplemented it. Sleep improved. Leg cramps stopped. He told me, "I had no idea any of this was connected. I thought it was just getting old." It was not getting old. It was information he had never been given. Take this to your next appointment. Write down your medication. Ask about its specific side effects. Ask when your last metabolic panel was. Ask about grapefruit if you eat it. These questions protect you. Drop this in the comments. Which blood pressure medication are you taking? I want to know what people are working with. I read every single one. Share this with every senior in your family who takes blood pressure medication. This information may genuinely change how they manage it. This is Dr. Daniel Harres. Take care of that heart. It has been working for you every second of your life. Time to work for it.